Obviously, everyone's situation will be different, and we always need to pay attention to public health authorities. When it is possible for me to keep 2 meters distance from people, that is what I prefer to do. In situations where I'm either walking through the halls of Parliament or going to my office and coming in proximity to people, I've chosen to start wearing a mask. I will be wearing a mask as I go into Parliament this afternoon for our in-person sitting. Once I am at my desk in Parliament and 2 meters separate from everyone else, I will take off my mask so I can engage in parliamentary discourse. But as soon as I leave my seat and walk past people and walk through potentially busier hallways, I will be wearing a mask. That's my personal choice. That is aligned, I think, with what public health is recommending. I think we all need to adjust to what works in our circumstances and keep safety at the forefront of what we're doing.
So that's a specific recommendation, if you like, as opposed to be, I think the previous language was more permissive. So I think just to rewind a little bit, the Chief Medical Officer's position from the start was that, of course, these masks protect others. So if you're wearing it, you're protecting other people against your droplets. So at the start, it was obviously someone who is sick, who's coughing or sneezing. If they're going to go out or have to go to a medical appointment, for example, they need to cover the cough and with facial covering or mask. That is for the sick person. So it's when we got more evidence about asymptomatic and pre-symptomatic individuals, and that although we don't fully understand their role in transmission, it is an added layer of protection, even for people who don't have symptoms, to wear a mask to prevent transmission to others. And even though the evidence base hasn't changed too much, and particularly as people have generally been staying at home, and now that we're sort of reopening or restarting a lot of the activities, the Chief Medical Officers felt that they can recommend this for people who cannot maintain that 2 meter distance. And more specifically, if there's virus in your, there's been community transmission in your jurisdiction. And as Dr. News said, jurisdictions felt that they need to do that risk assessment because there's some provinces and territories that haven't had community transmission, and others who have clearly have and continue to have community transmission activities. So they will do their individual risk assessments in terms of the very specific recommendations locally. But I think that, from our perspective, it is an added layer of protection. It is for you to protect others. So if 2 people are wearing masks, I'm protecting you and you're protecting me. And so I think as more people do go out in the community, you can imagine there'll be more people on public transport, or maybe more people, some of the retail stores are beginning to open, for example. And if you can't predict whether you can maintain that 2 meter distance, then it's recommended that you wear the non-medical mask or facial covering. Okay, so at the national level, it remains a recommendation. And as the medical officers of health needs to look at their own particular context in terms of whether they actually have evidence of community transmission. And some areas actually don't and have actually never had community transmission. Is very different from, say, maybe, as Dr. New said, comparing Montreal and Toronto to Yukon or the PEI might actually be very different. So they need that ability to make those recommendations. Their public transportation systems might be different, for example. And so they need the ability to do that risk assessment and recommend it from their perspective. From the federal perspective, Transport Canada, of course, given that's their federal jurisdiction, did make the wearing of non-medical mask mandatory on those conveyances. So that is within the federal jurisdiction.
And Dr. You maybe I'll just add, certainly understand the interest in terms of the use of non-medical masks, by the general public. But one of the issues we're also obviously with our counterparts in the provinces and territories looking at closely is that the unintended consequences, where if you people think that by wearing a mask in public, they don't need to follow all of the other important public health measures that we've been underlining so many times in terms of guarding, the distance, the physical distancing of 2 meters, etc. So that's one of the things I think we still need to underline, that this is, quote, a supplementary measure that people can use to protect themselves when it's difficult to maintain that physical distancing of 2 meters, but it certainly does not replace all of the other good measures such as hand washing, etc. Thank you.
Thanks. And as a follow-up, sorry, there's an echo. As a follow-up, Dr. Tam, so as you mentioned previously, it was already suggested to wear a non-medical mask when we go outside. Now it's recommended, but in places like Quebec, for example, it has been recommended, strongly recommended, for a week already, and we see that people are not necessarily wearing it outside at the grocery store or in other locations where they can't social distance. So what exactly can you do as public health officials to ensure that something actually changes on the ground? Your language is changing, but people aren't wearing it more.
I can't speak to the very local jurisdiction, and they will adjust their approach as needed. But I think from certain public opinion research, etc., Canadians are wearing more masks, and they are more. The social cultural shift is beginning to occur. So part of what public health is doing is, the concept is one, I think, of reciprocal protection. So I think for Canadians, thinking of it as I'm protecting you and you're protecting me is a very key concept. We have to gain the trust of the Canadian public and get their buy-in to do all of this. Mandating is one measure, which some jurisdictions might take if they have to. But for the most part, I do think that the shift is occurring in the population as well, which I think is great.